My name is Dr. Alexander Krakovsky. I practice cosmetic surgery in Southern California. I'd like to introduce you to one of my patients.
Several years ago, I began looking into the penile implant aspect of things, and several things I looked at. One was the history of older types of implants where you had fat injections, and a lot of that was reabsorbed in. And then I found information about a silicone implant. So I contacted the people who were dealing with that and talked with them over the phone about a silicone implant. And it was appealing because it was expressed that, it was very similar to a breast implant in a woman. We all know that, the silicone is in the woman's breast and there's no physical reaction to it, and it's a very sterile situation. So we made the appointment to come meet with the doctor and actually see the implant, because it's not shown to you in advance. You don't really know what it looks like. The fact that you couldn't see the device before you got to the doctor's office and he let you see it then, but then closed it back up and locked it back up because it was a patented device, those should have been warning signs. Those should have set off alarms to me. And the fact that he was very much, after he met me, I didn't feel like he really needed to know that much about me. He just was ready to do a procedure, and I was the next person in line. At that point, it was a mad rush from the doctor's meeting until we had the surgery that afternoon. Within a couple of weeks, the healing process was pretty much complete, and I started having some problems with it. With a breast, there really is no movement, but with a penis, you've got the natural refraction of the penis that, it goes in and out. And as that was occurring, the silicone sheath started bending at the sides. And I thought, well, this isn't right. This isn't how it's supposed to work. So I started investigating more and found that there were other people with complaints about it. So then I started searching out, well, how can I get this fixed? What can I do to repair this situation or have it removed? Do I need to have it removed? And I came across Dr. Krakovsky's website, and I contacted his personnel about it, because on his website he has pictures about the different types of reconstructive surgery that he does. And one of the pictures looked very much like the way my particular implant had developed. It had developed into sort of a hood. It was pushing its way down past the end of my penis, past the head of my penis, so that it was then just sort of a big shadow over the top of my penis, and you would have to push it back down into place. And there was a picture on his website of someone else's penis where this had happened. And so I contacted them, and several of the reasons why I contacted Dr. Krakovsky was in researching him, seeing his training and his experience, and the fact that he dealt with this situation before as performed by other doctors and had experience in removing the silicone implant and repairing the damage that was done, because let's face it, damage was done by that. I would recommend to anyone who's going to have this kind of surgery to research it. Keep in mind that a silicone implant in a penis is not designed to function properly. It's just not going to work correctly. It's not designed to move in and out and expand and contract as a penis does. And I think the process that's used now, which is more of a alloderm procedure, and then there's also the taking the materials from your own body, that is much more, it seems to have better results from everything I've read. And we've talked about other patients that he's had to do this procedure on, and that's really why I chose him, was the experience in removing the device and his training for this sort of procedure and doing reconstructive surgery. He will come pick me up at the hotel, do the procedure, and then he'll deliver me back himself, which lends a whole lot toward the patient patient-doctor relationship. It really helps make me feel comfortable with what's going to be going on.